Welcome to Edison TV. My name is Max Hayes, a TMT analyst here at Edison. On Wednesday, the 8th of December at 3 p.m, we will be kicking off our digital health series, exploring the investment opportunities in digital health. In our first webinar, we will be speaking with 3 listed companies providing digital healthcare services into the UK and other markets, discussing how we build a healthy ecosystem which benefits all. In the lead up to the webinar, I'll be catching up with the C-suite executives on the panel from Babylon Health, Dr. Care Anywhere, and Kooth. Today, I am speaking with Dr. Bayju Thakar, co-founder and CEO of Dr. Care Anywhere. Hi, Bayju. Thank you very much for speaking to us.
Hi, Max. Thank you very much for having us.
Fantastic. Well, just to start off, please could you give us a brief overview of Dr. Care Anywhere?
Sure. So Dr. Care Anywhere is a digital healthcare company. Obviously, that's why we're talking to you today, Max. We kicked off in about 2013, starting as a virtual GP provider with our proprietary platform and our employed clinicians to provide access to high-quality clinical care, predominantly in the UK. And our evolution since 2013-14 has seen us extend our virtual GP service to include diagnostics and specialist care on a single platform with our clinicians to provide integrated, joined up primary and secondary care, digitally enabled in the UK.
Fantastic. And could you just give us an overview of your growth strategy, including expansion into new geographies and different areas of healthcare, such as mental health, as well as the opportunities in both primary and secondary care?
Sure. I think for all the digital healthcare companies that you have at this event, and for others, it's been a remarkable 24 months and probably a once-in-a-lifetime opportunity for digital health players to really capture growth. And we have certainly seen that, and we've certainly captured it, growing over 100% year on year for the last 2 years. Has been incredible, conducting more than 45,000 consults a month in our UK market through our virtual GP service, and now starting to see a huge amount of growth in our diagnostic pathways and specialist reviews through our channel partners, and in particular AXA in the UK, who have been a massively supportive partner to us. But not just that incredible growth, we have expanded into Australia following our listing on the Australian Stock Exchange through the acquisition of Psych2U, which is a virtual mental health business focusing on regional and rural mental health services in Australia, again through another large and very committed channel partner, HCF, there in Australia. And we've also expanded into the Irish market organically, working with Walgreens Boots Alliance to expand our footprint there. We've also had growth into Europe through Allianz, the big German insurer, where we're serving their IPMI book. So a huge growth year for Dr. Care Anywhere. It's been hugely exciting, and that gives us clearly a huge amount of growth potential again over the coming 2 or 3 years. Very exciting times for us.
Very interesting, very exciting. But in which areas of healthcare do you see the greatest mismatch between demand and supply, which can be mitigated through telehealth platforms like Dr. Care Anywhere's?
So clearly in healthcare and all health systems around the world, there is a mismatch of demand and supply. Demand is going through the roof across both acute and chronic disease, and depends on what ecosystem you live in. In the Western world, the shift in demographics and shift in need is more around chronic disease. And we've got a shortage of supply of high quality clinicians who fit that demand. So where digital health businesses will win and be able to really be helpful to patients is knowing how to optimize that workforce, making sure that you get to see the right clinician for the right amount of time at the right time. And then, of course, being able to use data that underpins that to empower the patient even more, so that they don't need to use a clinician and can look after their health as much as possible. Now, those things are going to be done through AI, smart triage, and better workforce optimization. And critically, those of us who are joining up the health system, bringing primary care, secondary care, and tertiary care together, will take out a huge amount of inefficiency. And ultimately, that all leads to increased capacity on a restricted supply side, so we can serve more and more people. And that is an exciting time for health systems, as long as they continue to embrace digital healthcare and see the benefits that they can realize.
Great. And to finish, what do you think the future of digital healthcare looks like?
So, if you're stretching out 10 years, we should probably be thinking about the metaverse. and how healthcare is totally going to change. But it is slow to adopt new technology sometimes. But what we're seeing right now is pretty rapid adoption of digital healthcare. And what really excites me is as we start to now think about digital diagnostics and digital interventions. So what a lot of people in this space have been doing, including us, is thinking about the digital infrastructure that can bring high quality clinicians and patients together and work within that ecosystem to make things more efficient and optimize the use of our workforce. But as we now move forward and we're collecting all that data in the cloud, are we going to get really much savvy around digital interventions which drive costs down further and are more scalable, digital diagnostics which allow us to get people the diagnoses they need faster, and digital management programs? All those things will be vastly cheaper, much more scalable, and basically reduce inequity and inequality in healthcare. So super exciting times, but it will need to be underpinned by the data that we're all starting to collect in the cloud through bringing clinicians and patients together.
No, definitely exciting times. And thank you very much for speaking to us today. Really enjoyed the conversation. Thank you, Bayju.
Thank you, Max.